The report we've put out documents for New York State what is a national epidemic of unnecessary cesarean sections. Most people don't realize that the most common major surgical procedure done in the United States is a cesarean section. It's also the most commonly unnecessarily done procedure. If it's necessary to do one to save the baby, to accomplish something you can't accomplish through the normal delivery because the woman's too small in her pelvis, it's a good thing. And when the percentage of cesarean sections in the country went up to 15 or 20% of all deliveries, that was probably about the right rate. But then it went to 25 to 30 to 35. There are some hospitals where 45, 50% or more of the deliveries are by cesarean section. And what we're saying in this report and documenting is that an unnecessary cesarean section is really a form of violence to women. It exposes the woman and the baby to unnecessary risks that they wouldn't experience if they had a vaginal delivery. The basis for our saying that about a third of the cesarean sections in New York State, or nationally for that matter, are unnecessary is that in New York State, if you look at the 10 hospitals with the lowest cesarean section rate, urban, rural hospitals, hospitals that take care of very difficult pregnancies, the average cesarean section rate there is 28.8%. It's a third less than the overall state rate. And what we're saying is that if all the hospitals in New York State averaged out to 20.8%, we would have a third fewer cesarean sections. And what that would mean was that in 2007, there would be 30,000 fewer cesarean sections in New York State alone. Nationally, we're talking about hundreds of thousands of unnecessary cesarean sections. What women need to do are several things to try and avoid an unnecessary cesarean section. If they can, they should hook up with a nurse midwife or a midwife, a licensed midwife. There's no question that for low-risk women, which are most women who deliver babies, their chances of having a cesarean section are much lower if they go to a midwife than they go to at least most OBGYNs. They can find out by looking at our report on citizen.org for every county, every hospital in New York State, which hospitals seem to be doing the better job. The report lists not only the C-section rate, how many midwives are there, the odds for a vaginal birth after you've had one cesarean section. And that's sort of another important way of reducing the cesarean section rate. It used to be that almost a third of women who had one cesarean section would have a vaginal birth afterwards. It's now fewer than 1 out of 10. And we think that that rate needs to be raised. In other words, just because someone's had a cesarean section doesn't mean that they have one for the rest of their lives. So there are a lot of things women can do and hospitals could do, like having mandatory second opinions for cesarean sections and inductions to lower this epidemic of unnecessary cesarean sections.